Hey, good morning, everyone. My name's Diana Lindstrom, and I'm with ACES Medical. And we just wanted to thank you for attending our webinar this morning about HIPAA, and especially with a focus on patient communication. We're going to have two speakers today. The first will be Patrick Dowling. He's the Principal and Vice President of ACES Medical. And one of his focuses is making network security technology available to medical clinics of all sizes so that medical practices can incorporate the latest network security technology into their practice without breaking the bank. He oversees the unique product offerings at ACES Medical, as well as ensures the offering of the best, most technologically advanced services. Also joining the webinar is Steve Fields. He's the Director of Sales and Marketing at CallPointe. He's been doing that since 2005. He manages CallPointe sales and customer service teams, along with leads the marketing initiatives. He has worked the last 15 years in the healthcare industry, helping medical providers improve their patient communication. Before entering healthcare, Steve worked in telecommunications for over 25 years and has a background in leadership, marketing, product management, and sales. So just a couple quick things before we get started. Please feel free to ask any questions. Your line is probably muted, but there is a questions window. So feel free to type any questions you have throughout the presentation. I'll be kind of tracking them as they come in. And once Patrick and Steve have finished kind of their speaking, I will go through the questions and Steve and Patrick will answer those as needed. And then also, I believe you can also raise your hand. So if you're having questions or an issue, just raise your hand and I will be sure to help you on the side while the presentation's going. And just one last heads up before we get started, I am recording the webinar and we'll be sure to email out a copy to everyone over the next couple days. And with that, I am going to switch to Patrick so he can get started on his presentation. Thank you so much.
Great, thank you very much, Dana, and thanks everyone for coming to our webinar today. Just wanted to go through some information with you today about HIPAA and some of the changes. We're going to focus around patient communication. I work at ACES Medical and I do a lot of work with practices across the country of all sizes, from enterprise institutions down to one or two physician practices. And one of the things that's really important to me is that we look at good information and look at how we comply with all the necessary requirements, because if we're even a one or two doc practice, we need to make sure that we comply with all of these rules and regulations regardless of our size. And one of the things is my background, that I've been doing this for over 20 years now, is really working with how we can bring all these services together and get good people information all about how to comply and how to improve the security and compliance in their network. So one of the things to think about is just this year and some of the changes with HIPAA is you may have seen some of the emails that have come from CMS and others starting with the spring of this year. So what they did is we started what's called the phase 2 of HIPAA. The omnibus rules were passed as phase 1 in September of 2015, which really went down through all of the individual requirements under HIPAA and really kind of specified what specifically under HIPAA you needed to do and information that needed to be required, and that was in what was called Section 164. But what this phase 2 has really done is governments recognize that they need to have an enforcement mechanism other than just a breach. So with this information that they're doing, what they're actually doing is, in a non-breach situation, Congress has funded this year the ability to do on-site audits. And they've done about only 80 to 100 before. And the thought is over the next, this is going to be for about the next year and a half, that there could be as many as 2,500 audits. This is all based on Medicare ID or other risks or things that you have if you've had a higher risk or breach in the past. So these are really important because it's not only just a breach situation where you have to have this, you can actually get an audit and a request for information. This could be an on-site audit or just a request for policies and risk analysis and other things as well. The real focus on this is compliance and really making sure that people are complying with all the rules and regulations. And what they really want to do with this is they've had make sure there's real financial penalties and consequences associated, civil penalties and consequences for people that have non-compliance as well. These penalties can range from $50,000 per violation. So with a lot of these cases and a lot of these audits, they have tried to really want to set the example to make sure that people comply with all the new omnibus rules. So just a couple of cases here, and I like to pull these out to just see some of the most recent fines and other things as well too, is looking at the Ferentz Institute for Medical Research. This was the $3.9 million civil fine from CMS, and there's only about 1,300 patients that were affected. But if you look at what they were really filing, and what the fine ended up being for was only the breach. It was a breach situation, but it was because they lacked policies and procedures and safeguards for PHI, and especially around regarding laptops. So they didn't have a policy, they didn't have an enforcement mechanism, and they didn't have training. And also the other is North Memorial Healthcare of Minnesota is $1.5 million, and this is only for 9,400 patients. So this isn't millions and millions of patients, but in this case they didn't have a business associates agreement and lacked a thorough and complete risk analysis. So this is something that's really important, because all of these civil fines can really, really happen for things that that you may not even think, or that they would only be kind of a small slap on the wrist or a small fine. But these fines can add up. The violations, they do it per violation, and can be a large amount of money. And the way you protect yourself against that is having all the necessary information to comply from a policy, procedures, training, and risk standpoint. So the important thing under the omnibus rules in 2015, they really specified, and I try to boil this down into really called the what, when, and how. So what are users and staff members doing on the network? When are they doing it, and how are they doing that? And be able to track that information. Different EHR systems and others, PM systems, have different levels of tracking and logging information, but also looking at your network level and file change and deletion as well too, and also looking at each of those items and being able to have reports and log files that you can be able to use and present as part of an audit that you're doing that. A lot of this information is hard to find, hard to get, hard to report against, that you need to. And so that's why we recommend a number of third-party tools or other things to be able to report against this information. So you have user tracking information that's part of your curriculum that you have, that you can put in your file as part of HIPAA compliance. It's also, we've seen when this has been trained and people understand what's being tracked and how it's being tracked, this can really cut down on fraud and other things as part of a training program, because all this information is being tracked and logged. So it's a good prevention mechanism, but it's also required under HIPAA. And if you do ever have a breach or an internal employee theft or something like that, it's very quick and easy to be able to pinpoint the information with a good tracking tool on the system. So this has been something that CMS really emphasized as part of the omnibus rules in 2015, and enforcing it now. Is we're not just going to paint broader strokes. We're actually going to tell you what information we want to have tracked in these reports, and we're going to have this. We want this included as part of your risk analysis. So one of the important things is talking about patient communication and how we communicate with our patients. And Steve is going to go through some great information about appointment reminder calls, texts, and emails, and all the requirements that are especially around patient reminders and how to comply with all those as well through a reminder service and doing that. But I'm going to specifically talk about how you communicate with patients if you're talking about sending out information like a clinical visit summary or other patient education information or other PHI as well. And one of the most important things is establishing a clear policy about your encryption, how you send information out to patients if you're going to use email. There's a lot of good encrypted email solutions that come with the patient portal, or there's third-party standalone that can hook in with Outlook or others, which basically allow all that information to be transferred to the patient in an encrypted manner, and for the patient to be able to get that information not through unsecured email. So it's really important to adopt a policy and to have a training procedure on this as well. Too many times I walk into practices and there's always people that may not are using email for other means that they shouldn't be under HIPAA, and they're actually including some form of PHI to that. I've seen reports being emailed, financial reports, other things that contain PHI on them, just internally as well. So having a good internal email encryption solution as well, if you're sending that information with PHI around, but then also from the patient communication side, also making sure that you have really great encryption and software to be able to do as well. And the greatest thing about encryption is, I always say it's very tough to actually hack the encryption and to move through. I equate it to like a giant concrete tunnel. And it's really tough to ever break through that top part of encryption to get that data. The endpoints could potentially be breached by the patient account, but this way there's a secure transfer all the way through, and that's why it's allowed under HIPAA. Same thing with text messaging as well too. You want to make sure that with that, a lot of things that I'm seeing right now too is a lot of information is going over text, which is fine. But how texting, is it going to people's personal cell phones or doctor's cell phones? I see people responding to those text messages. What's on their individual device? How are they sending it is all important. So if you use text messaging, and Steve will go into that about the reminder side, how that can do it, but I'm thinking specifically just on sending information out to patients, is there's a number of tools and other things that can integrate as part of a unified communication message with texting. And that can be done to integrate with the patient portal as well. But the importance of this and those tools is really how and what policies you set and what is the individual distribution rules that you've set up and how you do this, and training people on this. Not just the policy and procedure, which is important, and you need that as part of the audit, but actually training this and going through scenarios and working with your staff members on how to handle all the things that come up as well. Also training for telephone communications. What information do you allow to be given out over the phone? Even just things like other people's family members, other things in different pieces. Is how have you documented that policy and procedure over the phone? And how do you train and come back on that and work through that and have some kind of monitoring? So sometimes part of the training process or others, there is different recording or things that people will do to actually go back and double check with some of their employees to see that they're doing it correctly. But in absence of that, really going through clear scenarios and walking through scripts and examples, we do all the time from a training standpoint, which really helps as well. Then also thinking about the referring providers and what's your policy regarding how and when you send information to referring providers as well too, and release of records is all important. And having all of that process documented and your policies and procedures, but then also having the training curriculum and plan to implement that is important as well. So I was talking about training as well, and one of the things about training as required under HIPAA is really, our emphasis is really working through to prevent the human engineering side of attacks. There's a lot of attacks that are happening not only on the network against all of the PHI or singled out parts that start with the human engineering aspect. Just had an example recently of a client who got a call from someone from Microsoft, and just the first time they called them and they said, we just need to update your computer. Anybody who's ever worked with Microsoft knows they never call to update anything on your computer, but this person and staff member had given out some information, and they had almost got control of this person's PC, and what they were going to do at that case was get control of her account and her PC through a remote access tool and use her permissions to steal large amounts of PHI out and take that information out of the system through reporting and SQL scripts as well. So it was a very coordinated human engineering attack that was used to try to extract data. Now, they didn't come directly through the outside firewall, but they came through. And so dealing with vendors, and vendors were calling and talking about what happens when a training procedure, when someone calls up and says, I need to have access to your system, or I'm ex-vendor, what happens? And that's what people are exploiting, and that's what's happened at the University of Wyoming, and there was other examples where ransomware has been prevalent. So that's an important part to have as part of your training curriculum. But as part of that as well is, how do you train your employees to actually put them in the scenarios? And so one of the things that we've tried to do a lot of is a lot of the training kind of is almost classroom style, and people kind of tune out as part of the training. So one of the things we've always tried to do was include animations and other little information and tell stories and use actual examples and to go through and make the training interactive so that people can really learn and retain the information. We found that video has a much higher engagement rate, and people have a much higher level of engagement, but also a much higher level of retention. And breaking that into size and chunks that we can all understand and is great and can go across the clinic is really, really important. And then the other part I think is that I see as missing is, do people actually have a quiz, or are they tested on the information? If we can't measure the information and we don't know if people retained it, we don't know where the deficiencies are in the training program or where individual staff members may need some additional training. So we talked a lot about, and you saw some of the individual examples about a risk analysis. And I always call this is a living and breathing risk analysis. So you always want to update it at least once a year, but we work with our clients to do that on a quarterly basis as well. And this becomes the basis of any audit or information. And it's really important for compliance, but it's also really important for improving your network security and infrastructure. And this risk assessment in the omnibus rules, they have section 164, which goes through a number of specific requirements that you need to include in this as well. But the important thing of this risk assessment is when you find a risk is to note it, but also come up with a plan to deal with that. So it's really, really important, especially if you have multiple risk analysis and something that's high risk on your network. Say you're running an older version of Windows XP or Server 2003, or things that are Java 6 that have had really large security breaches and information, that you really, really take a look at how are we going to mitigate this risk immediately and how are we going to move it from the network. So one of the reasons why we always like to circle back other than just annually with our clients is after you note this risk is coming up with a plan right after it and noting that in the risk analysis to mitigate the risk and then remove it off the network. And that's a really important part, and it's a really important exercise. And the first thing that they'll ask if you ever get an on-site audit is to see your security and risk analysis. But it's also a really important internal document for process improvement and security improvement in the practice. And so we always like to revisit that. A lot of places just do it on an annual basis. We like to do a larger annual assessment, and then quarterly, whenever there's those noted risks, come back and work with clients to make sure that they've been mitigated and taken off the network. Well, great, and I'm going to send it over to Steve now, and he's got some more information for you on the specifics of HIPAA as it relates to patient reminders.
Thank you, Patrick. That was some great information. It really helps us set the stage to talk about patient communication. And I'm going to take a few moments here and really look at messaging that should not contain any PHI in it. I have been in this industry now for about 15 years in patient communication, so I've seen a lot of changes and answered a lot of questions about HIPAA. And now we even have another government agency that we're going to talk about, which is TCPA guidelines. So let me jump in here. So we'll start out, and your practice really needs to have a strategy on how you want to communicate any messages out to your patients. So as you're crafting your strategy for communicating with patients, number one thing you need to worry about is HIPAA, and are we being diligent and not giving out any private information? And the great thing about using a service like CallPointe is you don't have to worry about that employee that calls up someone and it's not the patient you intended the message to, it's a spouse or someone else in the household, and they just give out way too much information about the appointment or on the diagnosis or anything like that. You know, once we have your message script, that's what we're going to deliver, and and we don't go off script. So that's kind of a nice added benefit. The other piece that you need to consider in your messaging strategy is the Telephone Consumer Protection Act. Came out in a recent update from the FCC, and it really focuses in on your communications, not only to patients, but to patients via their cell phone. So whether that's a text or a telephone call, going out to a patient's cell phone, and it's really from an automated system or service like CallPointe. They've added some restrictions for us, and we'll go over kind of what those restrictions are for you. And really, in the TCPA, we break down messaging into really two categories. So the first category is what is considered medically relevant. And so these are messages that pertain to the patient's health care. And a couple examples are, of course, appointment reminders. This is one of the things that came out and was talked about within the ruling of TCPA was how patients actually like getting reminders. We're all very busy in our life today, and it's very easy to forget that appointment. So an appointment reminder is something that patients do like to receive. So another example is preventative care or recalls. You know, we walk out of the office, 6 months later we were supposed to schedule a follow-up appointment and we didn't do that because we left the office quickly. We're supposed to have our annual physicals. These type of things are all covered under medically relevant messaging, as well as operational things like inclement weather, you need to get a call out very quickly, or what's become very popular today is contacting patients after they no-show with a message to remind them that they missed their appointment. Or, for example, if you're adding a new provider to your group or you're adding a new location to your group, those are all considered medically relevant messages and are allowable. The non-medically relevant messages, the TCPA ruling has put additional restrictions on what an automated system needs to do to ensure that we do prior to delivering these types of messages. And really, non-medically relevant type of messages are balance reminders or marketing messages. So some of you are saying, what's a marketing message? So a good example are an ophthalmology group may be offering 50% off on lenses or contacts, or a dermatology group may be marketing out to their patients a new line of skincare. So those things are really considered marketing messages. And what the TCPA has said is if you're going to use an automated system, you're going to need written permission to do non-medically relevant messaging out to them. So within your notice of practice privacy, you really need to have that clearly spelled out if you plan to do that type of messaging out to your patient. Where anything that's considered medically relevant, all that requires is implied consent, which is defined as a patient simply giving you their cell phone number is considered implied consent and allows you to deliver those messages out to your patients. So as you're crafting that message that you want to have delivered out to your patient, a couple things that you can do, your do's that, pardon me, is patient's first name. you can, in your message out to your patient, you can say, this is a message for Mary regarding your appointment on day, date, and time. You can include the provider's name. So this is Dr. Smith's office calling to remind you or remind Mary of your appointment. You can include the location at our Winston-Salem office or at our Greensboro office. Of course, you can include the date and time of the appointment. And you can also say, especially if you've crafted a new patient message, for example. So your new patient, you want to remember to remind them to bring their insurance card, their ID, any paperwork that you've provided them, a list of prescriptions that they're currently taking. All of that information can be included in your message. So a number of things you want to avoid or be very careful with. You don't want to use a patient's last name in the message. That then opens you up to HIPAA violations. You don't want to give a specific value or dollar value of a balance that a patient may owe. So what you might do is tell CallPointe, include a snippet that says you have an outstanding balance that will need to be taken care of at the time of service. If you have any questions, please call us at this number. So you can call with a separate message that says that you have an important business matter to discuss, but you should never really give the specific past due amount or amount they owe in the message. And then anything that related to a diagnosis. So for example, in your message, if you want to say, hello, this is Forsyth Internal Medicine, that's fine because there's no diagnosis associated with internal medicine or family practice. But if you work for an oncology or endocrinology group, then you really want to take a look at most likely just using the provider's name and not indicating that your group name. And the same thing with prep work. If you need to tell people they need to fast, remember to fast 12 hours and follow our prep instructions, you can say that. But if it's something that would only be associated with a certain diagnosis, then you really need to avoid that in your messaging. So one of the things I put together just a few frequently asked questions, and this goes back a very long time when HIPAA first came out. People were concerned you couldn't even call a patient, let alone leave a message on an answering machine. So the question was, can you do this? And it's been answered multiple times that yes, you can leave a message on an answering machine, but that you really want to make sure that you're only leaving specific data that you need. You don't want to go on an answering machine into great lengths of their message. Just give the minimal amount of information that they need. The next question that's come up more and more here lately is, do I need written permission to deliver messages? And this is really a split decision. It's no and yes. So if you're delivering appointment reminders out to the patient, or again, medically relevant information, then the answer is no, you don't need written permission. You have implied by simply receiving that telephone number from the patient. But if you're going to do non-medically relevant messaging out, then the answer is definitely yes, you should have that written permission to do that. So it really, as a precaution, to put that information on how you're going to be contacting the patient and getting written permission in your notice of privacy practices is really a good good step in your patient communications. And then our text messaging HIPAA and TCPA compliant? The answer is yes. But again, if you're not going to do secure texting, you need to make sure that there is no PHI divulged in that text message. So those are really the information to talk about patient messaging. Patrick has really gone into some great detail on some of the penalties. We want to make sure that our service through CallPointe meets your messaging guidelines, but also falls within the HIPAA and TCPA guidelines. So with that, I'm going to turn back over for some finishing comments from Patrick.
Great.
We'll
Thank
answer
you very
some
much.
questions.
Thank you very much. I appreciate it very much. Thanks for giving us a lot of good information. Great. So just kind of want to go through just a couple things to talk about, and we went through as my information is what are some of the necessary things you need as part of HIPAA compliance. We talked about the user tracking software, so what, when, and how. What are people doing it? How are you tracking that information? We talked a lot about training and establishing the training program, which is really important. New provider scenarios, other good information, and then follow-up to make sure that people are retaining the information. And the really important security and risk analysis. So looking at annually at least updating that security and risk analysis, but also make this a living and breathing document and make sure to show improvements as part of that risk analysis. Some other things is it's important, and just wanted to think about some of the next level of security on your network as well too. There's a list of advanced security features here which are not typically found on firewalls, that are pretty low in price, that have come down in price quite a bit, and also being Cisco umbrella. These are products that you can load on your network that make your network much more secure, protect against ransomware, and other things as well. It's also really important to patch all your individual systems as part of your risk analysis. So under HIPAA, it's important to see that all of, for Java, Adobe Flash, all of your applications, other things are patched on the network. So there was a number of reports that have said that 68% of breaches have happened because there's holes in vendor software that hasn't been patched by each of the individual groups or people that where the breaches happen. So patch management and tracking that on an automated basis is really important. So one of the things that we've done, and we've talked a lot about before, is how do we help get practices in compliance that are on any budget. So as part of attending a webinar as well, we have our first package, which we do a security and risk analysis, which runs about $8,000 typically, but we're doing it for $1,500 for new customers that want to come on who've attended the webinar. And this includes 20 hours to complete the security and risk analysis for you in all of Section 164 and 6 hours of HIPAA training as well too, which we record, and then there's a quiz after that as well too. So feel free, the information is here. It'll be coming out in the email, our 188 number, as well as our other information, and our website is acesmedical.com to take advantage of this special offer. And we're doing these for people to get them done in time for the end of the year and continually update that as well. So that concludes our information that we have today. Now we're going to do some question and answer, and so I'm going to turn it back over to Diana, and she's going to select some questions for Steve and I to answer. So feel free to, if you haven't put any questions into the chat window down below there under questions, then feel free to do so. We're going to answer some questions.
Thank you so much. And one of the first questions we have is asking about if we'll be emailing out this presentation. And yes, we will do that. We've recorded it, and so within the next couple of days, we'll get it emailed out to everyone so you have a recording that hopefully maybe you feel like you could pass on to someone else. So that will be coming out soon. And are there any other questions or anything else, or perhaps while we wait for a question, is there anything, Steve or Patrick, you wanted to say that maybe wasn't in your slides while we wait for a couple more questions to come in?
Sure. I think one of the things that is important and I was going to think about is helping to select all the individual vendors for your products. And Steve went through a lot of information about CallPointe and CallPointe services. And I think one of the things that's important, and we do as part of the risk analysis in our consulting, is looking at how to bring in those products to help supplement around the practice and what they can really do to help improve all these areas. Because it's tough to keep up on all areas of HIPAA and HIPAA communication and policies and procedures. And I think by selecting the products and by selecting good partners, and then also working through your policies and procedures and training information is important for compliance.
And we do have a question. I'm guessing this is more for Steve. The question is, if I understood correctly, TCPA guidelines states I shouldn't give the patient's last name when doing an appointment reminder. She's not sure if her message includes the last name or not. If it does, should she update her message?
Yes, it's really the HIPAA guidelines are do not, want the last name. When you look at what HIPAA is trying to accomplish, let's say we call the wrong telephone numbers in the system. By giving a first and last name, or even last name, we're really pointing someone in the direction so they could get the information for a specific person. Where if the call goes to the wrong number for Mary, in that area code, the chances that there are thousands of Marys or Steves or Patrick is very high. So you don't really divulge a individual person. So if your messages include last name, I would remove that and simply go to first name. And there's only one really caveat to that, is in situations where you may be calling a nursing home, for example, and you're calling one main number to remind them of Mary Jones's appointment. In that situation, if you just called up and said Mary, the nursing home would not be aware of which one. So you set up where you have a specific agreement in place with your business associates agreement in place with that nursing home so that you can divulge that information. But as a general practice, the answer would be no, you really don't want to include the last name.
Wonderful. And we do have time for more questions if anyone else has a question that they'd like to enter in the box. I'm not seeing any more questions coming in. Any other last thoughts, Patrick or Steve, and we'll give it a few more minutes to see if there's another question.
I'd like to thank ACES Medical and Patrick for allowing us to kind of co-host this with him. I think a lot of great information. There's a lot of misinformation out there about HIPAA, and I thought Patrick did a great job of giving you some good information and a reliable source to go and get an analysis done.
Great. Thank you very much, Steve. We really appreciate you coming on and giving us a lot of great information as well, too, about the reminder side. And I think it is why we really enjoyed putting this on, is giving people good information and a way to comply with HIPAA that's not astronomically expensive, but also make sure that they stay out of the mud as it relates to any type of compliance issues, audits, and really an ounce of prevention is worth a pound of cure. So I talked a little bit about the security products and having a risk analysis and human engineering. Is the cost of a breach scenario, the legal fees, the potential civil fines, the outside risk analysis that they do to identify the breach, the patient notification costs can be hundreds of thousands of dollars. And so a lot of these, not only the training side, the security and risk side, all of the individual products, working with a vendor like CallPointe to help you on patient communications and reminders, all of these pieces help to really prevent the chance and really dramatically lower the chance that you're going to have a security breach or a civil fine as part of an audit. And really, I think that that's what we see when we walk in and work with practices all the time. Is I just worked with a practice, and within 30 days, they had completely transformed their entire network and had entranced their staff and had a compliance audit that was done as a part of that, and they passed with flying colors, where 60 days before they wouldn't have done that. So this is something that, with just a little bit of work and time and expertise, can really transform the practice's security and compliance.
And we did get one more question. Again, I think this one would be for Steve. The question is, can we text patients and notify them that their lab results are in and to call our number to speak with their provider? Is that violating HIPAA?
Steve, I think you might be on mute.
Thanks, Amy. I was on mute. I've been coughing up a storm.
Okay.
The answer is yes. It's a perfect use of texting to get that message out to the patient and getting it to the appropriate person and having them contact you with their, to get the results. We also, CallPointe just recently created a new integrated lab delivery service with Centricity that's actually integrated into the Centricity service, where we can send out a text or a telephone call, let them know their lab results are ready to retrieve, and then call into a mailbox and retrieve that information that the provider or someone within the practice has recorded for them. So there is some new opportunities out there as well. I hope that answers your question.
Any other questions you'd like answered? And I think this is a follow-up question, Steve. Is that CallPointe service available now?
Yes, we've had a beta client working with that service. So yes, if you would like more information, please call or email me and I will get you some more information.
Perfect. And in my reply, I'll make sure to, if that's okay with you, Steve, I will give this person your email address so they can reach out to you.
Absolutely.
Perfect. Any other questions? All right. Let's see. So I haven't seen any other new questions pop in. We can wait another couple minutes, or if anyone has anything else they'd want to say to kind of conclude and let people get on with their day.
Thank you very much, everybody, for attending. As we said before, feel free to follow up. Anna will send out the information. ACES had my email address and phone number there, and Steve's email address and phone number will be on there as well. And we enjoy you taking time. There'll also be a recording if there's people in your organization or others that are available. And we're certainly here to help with any questions that you have or follow-up questions. So if a question didn't pop into your mind right now, feel free to always shoot us either CallPointe or ACES an email, or both of us, and we can certainly answer any questions that you have, or we hope to help you in the future with HIPAA compliance.
Again, thanks everyone for your time today.
And actually, we had one last question pop in if you guys are willing to answer one more.
Sure,
Certainly.
perfect.
Okay, the question is it okay for the patient to list family members on their HIPAA forms?
As part of that, talk about distribution of information and release of information. It's important in your disclosures. There's certain, as part of that, for talking about who and how you can release information to, and making sure that your release of information that you have in your documents is on file. So if there is a family member, especially if it's somebody who's chronically ill or others who wants to have that information released to them, that you include that as part of your documents and have a release of information for them as well. That way they can call up and get information about the patient. But it's important to provide that. We work with a lot of cardiology clients and others that have family members or other things that help them, that need to help somebody get there, or information that's there, and to make sure to include that in the release of information, that a staff member, and note that in the account or on the family billing side as well too. So if you're billing out all underneath a family, to have all of that as part of the disclosures, so other family members, if they're over 18, can talk about the charges on the account as well.
We did have a follow-up question. So if a family member calls to ask for a patient's date and time of appointment, or to schedule on behalf of the patient, can that be released without a consent form?
What I would always say in that scenario is make sure you have the consent form. You do not want to release, basically, because of the potential, if these are all people that are over the 18, family members. There's been a number of civil litigations and other things talking about release of information if it hasn't been the proper paperwork in place. I always advise my clients, as we're working through this, that unless there's a release of information for that family member, not to provide any other information about the patient than to that family member that's on file, as well. But there's certainly other people who have other policies and procedures, or maybe things that are slightly different. But under a lot of the release of information, I always like to have a clear release of information that's on file for any PHI that goes out the door. And if a family member requests like a medical records or something like that, you can always get a release of medical records and information to be signed by both of the patients as well.
Wonderful. And one more question. For minors who are coming in for OB visits, can we be sending reminders to the phone number on file? Typically, the minor has the parent's phone number on file.
A lot of times when in that specific case, I would say a majority of our clients would filter out any minors with an OB type of an appointment, and the office would handle those sensitive communications. They would have a staff member call on those situations. It's a very common practice to filter out a minor and a OBGYN type of visit.
Wonderful. Any more questions? right, I haven't seen any more questions come in. So going back to what Patrick said, I'll be sending out a recording of this webinar within the next couple days with everyone's contact information. So feel free to reach out either to us, to ACES Medical, or to CallPointe with any follow-up questions, and we'll be happy to answer those for you. Thank you so much for attending, and we'll get this recording out to you shortly.
Thanks, everyone.
Thank you. Have a great day.